Today we're going to talk about chronic IVDD in your dog's lumbar spine and ways that you can provide relief for your dog. Hi, I'm Tanya, and let's just dive in. So what is IVDD? IVDD is intervertebral disc disease. And in many senior dogs, we see a chronic type of IVDD, which means it's non-surgical. The space between the two vertebrae, there are some discs, and over time these discs start to dry out and have less water content. And the reason we have these discs is to provide cushioning between each of the vertebrae. So what can happen with a senior dog is we can get a chronic, like a pinching of the disc, where this nerve that's coming out from that spot is being aggravated by something like jumping up or going upstairs, or perhaps when they turn. So let's talk about what some of the signs are that your dog might have some chronic lumbar pain. Typically, you'll see the dog kind of roaching his back. He's trying to alleviate some discomfort in there. Some of the other signs that you might see with some lumbar pain, you may notice that they're hesitating or won't jump on the bed or the couch or into your car any longer. If it's something a little bit more serious, like in the front limbs where you've got a pinching of your nerve, you may notice them licking excessively at a portion of their leg. If that's not normal for them, you may want to investigate with your vet a little further. The last thing you might see is a dog that lies down after or during doing exercise. And the reason for that is when they're exercising, they're getting twisting and turning of the spine, which is aggravating the spine and kind of possibly pinching a nerve. And so they'll lay down on the ground to kind of take pressure off that spinal area. So let's talk about how you can quickly assess your dog's spine for any kind of pain that might be there. You want to feel this, you'll feel this ridge on the top. And so what you want to do is, from this here is your scapula, so you can put your fingers on either side of that nubbly bit on the top, because those are the top of the spine, and you just feel your way down the spine. And I'm just putting a little bit of pressure, and I'm just seeing, is there anywhere. And I like to do this standing, and the reason I do it standing is because if there's any pain, and this is sort of probably mild to moderate pain, when you go to push down, you may see that your dog will consistently sit. Where I usually see that is from in the lumbar spine, which is, here's this last rib here. So this is the lumbar spine from here, and here's the sacrum there. I don't expect you to know exact anatomy landmarks, but that's a general idea. But you're going to just press down, just not too hard, and just assess, is there any pain? Do I feel anything? Can I feel any heat? And then we get to this little flat bit here, which is the lumbosacral junction, or LS or L7S1, and I'm going to push down a little there. And with some older dogs, when I push here, you'll see them like go and sit. It's like, ow, I don't like that. So that's two ways to assess their spine. So now let's talk about ways that we can give our dog relief. There are so many things that you can do, but some of the things that you can do at home are things like doing moist heat. So you would do that in the evenings when you're relaxed, and what that does is help relax the muscles around the spine, thereby taking away some of that secondary pain. You can also do some gentle rubbing, or if you look at this video here on myofascial release, that's something that most dogs absolutely love. And a kind of a key thing here is, if your dog is having a flare-up, you want to keep them a little bit, not taking them out to do your usual routine of running around. And the reason you want them to rest is because you want some of that inflammation and that pain to dissipate, because if we don't deal with it right away, it will just take longer for it to go away. It doesn't mean that you can't walk your dog, it just means that you should just tone it down just a little bit. And following that, you obviously want to give pain meds, or if you don't have pain meds, you may want to talk to your veterinarian about it. The other thing you should do is in your home, in your home environment, you should probably put down some yoga mats or non-slip surfaces so that they're not slipping around. And if you watch this video here, I talk about clipping the fur between the pads of their feet because they act like they have slippers on and it makes them more slippery for them. And the last thing, which I find really beneficial, is what I call reaching for a treat. And so basically what's happening is we're having the dog reach for a treat, and I have my arm underneath the belly area. And what I'm actually doing is stretching out muscles, but also tractioning, very light tractioning of the spine. And the key here when you're doing this is you want to make sure that when the dog is reaching for the treat, if they start to move their back legs, then it means you're stretching too far. It means it might be a little bit painful. But you can do, hold this for 5 seconds and let go, and then hold for 5 seconds and maybe do 4 or 5 of those in a row. And anyone who has back pain knows that doing any kind of tractioning actually feels really good if you have anything kind of disky. This is a little bonus tip for you if you want to check to see if maybe there's something a little bit more neurological going on.
So what you do is you just take their foot and you just turn it over, and you can see with him, like, I can't even turn it over, like he's quickly putting it down. But with dogs that have very mild delayed reaction, especially in some of the really older dogs, is you go to put this over and it'll stay like that on the ground. So that tells you, it's called proprioception. So it tells you that the nerves aren't quite firing as quickly as they should be, and so there's a little bit of a deficit there. So if you notice that they can't turn their foot back over, that you may want to go to your vet and tell them that you did this little test and show them, and that should alert them that there's a possible disc issue in the. Usually it's from somewhere from up here to down here, but most times it's between T13 and L4 L3 is typically where I see the issues.